Hi everybody, it's Dr. Sherry Caplan from Vitality MD doing another episode of Ask the Doctor. So this week we have Pina, who is a 39-year-old female asking in about or has questions about recurrent vaginal infections. And basically what she's asking is she wants to know, why does this happen and what are things that she can do to help prevent this? Well, basically, recurrent vaginal yeast infections basically can be caused by many things, some of which can be hormones and hormone balance. So, example, women are on the birth control pill are a little more prone to having yeast infections. Also, women who are estrogen dominant, meaning they tend to have much more higher amounts of estrogen relative to progesterone, may also get yeast infections. Diet can contribute to yeast infections. So when we're eating a lot of bread, pasta, rice, cakes, and cookies, essentially high carbs, that actually puts you at a higher risk. Yeast love sugar, and so if your sugars are higher than they should be, that predisposes you. So we also know that women with insulin resistant, polycystic ovaries, and diabetes have a higher incidence of yeast infections. Believe it or not, stress can also affect gut vaginal flora and also can predispose you to yeast infections. And commonly people have an overgrowth of yeast in our gut. So basically we actually all have yeast on our body, but it's when the colony count gets to a certain point that it's on the high side, then we become symptomatic. And for women, we get yeast symptoms. Some other people have, gut issues and food cravings and a whole bunch of different things, but we're going to focus on the yeast overgrowth relating to vaginal infections. So basically we want to address that. So essentially what happens is we have a high number of yeast colonies in the gut, and then we sort of infect them into the vagina. And so believe it or not, wearing G-strings sometimes can actually increase the risk of vaginal yeast infections because of the string kind of moving back and forth between the vagina and the rectum. And basically you want to know, what can we do about it? So, well, first thing is trying to address those underlying causes. So, if your diet's poor and you're eating a lot of sugars, or your blood sugars themselves are elevated, then you want to sort of fix that and address that. Some women, sometimes coming off the birth control pill, may help them prevent that recurrent yeast infection scenario. If you're estrogen dominant, then perhaps seeing a practitioner who can help you manage that. Stress, well, we're all stressed, so again, learning how to manage our stress would be very helpful. And basically, then it sort of becomes, how do we address that yeast overgrowth in our gut? So there's a lot of medications and herbs that you can do to sort of help reduce that. And as a physician, I tend to use a lot of diflucan. I use an extended diflucan regime that a woman may do over 3 to 6 months to help reduce her colony count, so then she's less likely to get a yeast infection. So that kind of keeps them clear for quite a long time. Another thing that we will often do is we want to try to shift the pH in the vagina, because when the vagina is of a certain pH, sometimes the yeast is more likely to grow. So often using boric acid or sometimes vitamin C suppositories may be helpful. Also using probiotics in the vagina will help the vaginal flora to sort of weed out the yeast overgrowth. So there are many things that a woman can do to help reduce their likelihood of a yeast infection and also their likelihood of having recurrent yeast infections. Another thing that I like to incorporate in women who are having recurrent yeast infections and aren't successful at eradicating them is often doing an organic acid test, because that will sort of give us a bit of an idea. Are you having a significantly elevated load of yeast? And then we can actually measure that during treatment to see how long do we actually have to treat someone. So that's it for this week. And if you have questions and would like them answered on Ask the Doctor, email info@VitalityMD for your questions, and see you next week.